Hi guys and gals. It's been a while since we talked. Nurse Nene here. I'm just Nene today. So just stop by to say hello and give you guys a life update. I think the last time we talked, I don't know which platform I talked on, whether it was YouTube, Instagram, Facebook, or TikTok. But anyway, I am officially 3 months post-op tummy tuck. Somebody just can't let me be great. He always, I literally gave this 3-year-old our room. And everywhere I try to be, he want to be. But anyway, 3 months post-op tummy tuck. And recovery was going along just fine until I woke up with extreme pain. So let me take you back. So we just, we recovered from the Hurricane Milton. Prayers out to those who are still, affected, those who were affected, who lost everything. I'm praying for you. My heart goes out to you and your family. I pray that the resources are provided for you and God puts people in places where you need them. So just want to say that we had minimum damage. Hurricane Milton, a part of my roof in the back is missing, but it's more like not the whole roof, like it's not leaking into the house, but like the shingles and then like the underside of the roof is gone. Nothing major. And then we lost power for like 3 days. So Hurricane Helene, I actually evacuated for Hurricane Helene. My husband's a truck driver. He was on the road. I didn't feel comfortable with staying to the house by myself, although I'm not in a evac zone. Our neighborhood is called Royal Lakes for a reason. I literally have a lake in my backyard, and then there's another lake on the main road coming out of my neighborhood. So the first hurricane, I evacuated to my mom's house. This hurricane, I decided to stay home and kind of weather the storm. And just prayed for the best, prayed that the lakes didn't flood over. And they didn't. They rose, but they didn't flood. Of course, these are man-made lakes, so I kind of feel like they drain them. I was telling my son and my husband like a few weeks before, a week after Helene, I noticed that the lakes were kind of low. And I said, I wonder if they drained those lakes in preparation for this upcoming storm. So I wasn't sure, but they are man-made lakes. But of course, if they fill up and there's no way to drain that water off, they will flood the neighborhood. So that was my concern and the reason why I evacuated the first time. But this time again, like I said, Hurricane Milton, I chose to stay and weather the storm. My son's college sits on the back of the river, so he is always under mandatory evacuation. When they call it, he gotta go. So Hurricane Helene and Hurricane Milton, my son had to evacuate. So we had to go get him both times. But like I say, this time we stayed home. And just telling y'all leading up to what I'm getting ready to tell y'all. So that Tuesday before the hurricane, I woke up with extreme pain. Leave it. Thank you. Bye-bye. Bye-bye. See ya. Bye. I woke up with extreme pain. Now, just a little history. I have been having this abdominal pain for about 6 months, even before I had the tummy tuck. Stop. Sorry. So I'm back. So I have been having this abdominal pain for about 6 months now, well before I had the tummy tuck. I kind of attributed it to indigestion, gas. I thought maybe it was muscle strain. I kind of kept just brushing it off, but like sometimes late at night, I would get these extreme pains that would start like on my right side and travel up like right below my breastbone, right? So, but they would eventually go away. So I did not go to the doctor. You know, I can't speak for all nurses, but most of us, we are the worst patients. We kind of try to self-medicate, self-treat. We know how it is to, you know, go to the ER without just cause. So we try not to do it. At least I try not to do it. So I kind of just, you know, neglected that pain because it would go away. That Tuesday before Hurricane Milton, that Tuesday night, I woke up in extreme pain. That Tuesday, not Tuesday night, Monday night, I woke up in extreme pain. So, and this pain was like no other pain. Still the same kind of right-sided pain traveling up here under my breastbone, but it would not let up. And it felt like, and I know the doctor, I told the doctor, and fast forward, I went to the emergency room Tuesday because I was like, I got to find out what's going on with me. And if this is my appendix, because you know, we know nurses, signs and symptoms. If this is my appendix, I do not need to get stuck in this house with a ruptured appendix during a hurricane. So that Tuesday, I went to the emergency room. I was like, they won't catch me in a storm like this. No, sir, no, ma'am, no ham. So I went to the emergency room. They say any chance or possibility of pregnancy. And I'm thinking to myself, this man got me again. But I am on birth control, right? But you know, anything can happen, you know? Anything can happen. But I'm thinking to myself, man, and I honestly, like I said, this felt like labor pain. There's no other way I can describe this pain other than mild labor pain. Like I'm getting ready to push a baby out. That's what it felt like. So, you know, they, you know, ran down all the questions and all that. Took my vitals. And they said, well, we need to rule out pregnancy. Of course, the pregnancy test was negative. Man, y'all just don't know. But anyway, pregnancy test was negative, so we ruled out pregnancy. I am not in labor. But what's causing this pain? And in my head, I'm thinking, this is my appendix. My appendix is about to rupture. Y'all need to get it out before I get septic. That's all I'm thinking in my head. And you try not to, you know, as a nurse, you try not to tell people what to do. But okay, I know what this looks like. Year before, my son had appendicitis and had to get his appendix sucked out. So I never experienced this pain other than labor, but I know what this pain looks like. It looked like appendicitis. Get it out of me. But anyway, so they did an ultrasound and they did a CT of my abdomen. They said everything's fine. There's, you know, no complications related to your previous surgery, the tummy tuck, because I did give them that pertinent history. Because in my head, I'm thinking, okay, what else could it be? Is there something going on with my, you know, surgery? Something internally going on, you know, that I can't see, but maybe they can see on the ultrasound. There was like, there's no bleeding, no internal bleeding, nothing. Only thing we see is you got a gallstone in your gallbladder that is stuck in the neck of the gallbladder. That's where your pain is coming from. So I'm thinking to myself, okay, it's a relief, not really a relief because I'm still in pain, but at least I know what's causing the pain. So, you know, okay. So what they did was they told me, they sent me home with a prescription for famotidine, I guess to kind of decrease the acid in my stomach and stuff like that. And they told me to follow up with a GI specialist. I'm thinking, okay, you know, I know this is a gallstone. Maybe it's similar to like kidney stones. I've never had kidney stones, but you know, I know that kidney stones sometimes will work their way through and move through, and then, you know, the pain will go away. They did tell me this gallstone was stuck in the neck of my gallbladder. So I went home thinking, okay, this pain is, and what I know, so they offered me morphine in the ER. I declined it. I didn't want morphine. I have never had morphine before, I don't think, but I just didn't want it. I've given it before, and you know, I've seen it make people be a little loopy, and I just didn't want to be out of my head in this ER. Mind you, my husband was still on the road. I had left my 18-year-old here sleep at the house. My 21-year-old was with his dad, so I had to bring my 3-year-old to the emergency room with me. So during all this, I got this 3-year-old sitting in the hospital bed with me. So I was like, no, I don't want any morphine. She said, well, we can give you some Toradol. So that Toradol, man, I've given it, but I've never had it before. That's some good stuff. Good stuff. And I was just feeling good. So they was like, we'll discharge you and you need to follow up with GI. So that Toradol must have stayed in my system, because that whole day I was feeling good. That next day I was feeling good. Boom, Hurricane Milton hit, and it hit hard. As soon as the rain and the thunder started, the lights went out. The lights went out. It seemed like when them lights went out, that pain came back. I don't know what it is. They asked me, had I eaten anything? Because of course the gallbladder releases bile, right? And bile helps digest food fast. So when you eat, the gallbladder contracts to, I guess, release that bile. I hope I'm explaining it, you know, correctly. This is how the doctor explained it to me. And so it contracts. So when it's contracting, because that stone was in the neck of the bladder, that's what was causing that pain. And he says, and I say, you may think I'm crazy, but I know that I'm not pregnant, but the only comparison of pain I can verbalize this pain to you is it feels like labor pain to me. And he says, and that's what it is, this gnawing pain, because it's trying to, you know, it's contracting, and I guess it's trying to push the bile through that little bitty tube, but the stone is right there. So fast forward, if you can see, I went back to the emergency room. Hurricane Milton hit hard. I weathered that storm. Soon as light broke, I went outside and saw that we weren't flooded in. I told my husband, take care of my boys, I gotta go. He said, where you going? I said, I'm going back to the emergency room. In my head, I'm thinking, this just like an appendix, this gallbladder might rupture or something and get necrotic, and then I'm gonna get septic, and you know, down goes Frazier. Not me. I still got stuff to do in this world. The Lord still got an assignment for me, and I'm not gonna let my gallbladder take me out. No sir, no ma'am, no him. But anyway, I went back to the emergency room that Wednesday, or that Thursday after the storm cleared that morning. We still had no power. I said, take care of my boys, I gotta go. So I went back to the emergency room, told them I was just here on Tuesday. Same abdominal pain, but it is worse now. And they was like, well, we need to just check you again to make sure nothing has changed, because things could have changed from Tuesday to Thursday. So they did another abdominal ultrasound, another CT, gallstone still there. And they was like, you know, the gallbladder really serves no purpose. Actually, the gallbladder does serve a purpose. My mama said everything in your body serves a purpose, and that's why God put it there. But the doctor told me the gallbladder serves no purpose, and he says that you can live a healthy life without it. He says, and the plan of care normally in situations like these is to remove it. But they said there's one thing, we're short on staff because of the storm. So I said, I can't go home like this. I was like, and at this point, you know, you don't like to tell people, at least I don't like to tell people that I'm a nurse, just because I just don't. I just rather them, you know, do your thing, do what you do, because it's the right thing to do. So they was like, so you may not get the surgery today, and you may be here a couple days until things calm down here and we can get a surgeon in to perform the surgery. So he says you're looking at staying here through the weekend and possibly not having the surgery till Monday or Tuesday. So he was like, it's up to you. We can send you home, and you could come back. And I said, I'm not coming back. I'm not going to keep racking up these ER bills. I said, you know, and then I said to myself, you know, I didn't have anything for pain. I had been taking Tylenol, you know, but the Tylenol hadn't been working. So I was gonna just go ahead and go home, because I am not that person that will take up a bed if it's not truly an emergency. It was my emergency, but they had other emergencies related to, you know, things that had happened to people during the storm and all that other stuff. So he was like, it's up to you. And right when I was getting ready to tell them, I'm just go home as long as y'all give me something for pain, and I'll try to follow up with the GI. Mind you, if I would have went home, it would have been a whole process, authorization from insurance, you know, outpatient procedure and all that other stuff. That could have took weeks. And I'm thinking to myself, Lord, provide the resources. Next thing I know, the surgeon coming in there. He was like, you know, and he started asking the questions. He was like, you know, of course, you know, this is your gallbladder. You can live a healthy life without it, and the plan of care is to surgically remove it. And he says, I'm going to do that for you. He says, today. He says, it's just, I don't know what time today. It's just a matter of lining up the people in place, because we have limited resources. I was like, God always look out for me. God, Lord knows, the Lord knows I ain't deserve to be in that much pain. I was like, man, I wouldn't wish that pain on my worst enemy. I don't wish labor pain on my worst enemy. I wish babies on y'all, those that want babies. But I don't wish labor pain on you. But this is what it's felt like. So I'm like, dang, I don't know what it is. But whoever sent that bad mocho to me, I got you. I got you. I'm just playing. But anyway, but yeah, so this surgeon came in. Next thing you know, maybe about 30 minutes later, the OR nurse was coming, telling me to take my jewelry off. Is there anyone to get my belongings? Mind you, this time I was by myself because I had left my husband at home to watch the boys. Well, my 18-year-old don't need watching, but of course the 3-year-old. So I was at the hospital by myself. You know, we don't have any family here. It's just us. My mom is 3 hours away. My mother-in-law is 2 hours away. So it's just us, you know, we do what we have to do when we have to do it. So, you know, they were coming in there telling me to take all my jewelry off so they could lock it up. They were getting ready to take me into surgery. So, long story short, I am 3 months post-op tummy tuck, 1 week post-op cholecystectomy, aka removal of a gallbladder. Man, my life can't get no more excited than that. So I went to the doctor on Friday for my post-op follow-up. He says everything is fine. I got to take it easy for the next 6 weeks. No lifting, no pulling, things like that. And he said that I should be able to, you know, get back to my normal routine in about 6 weeks. So yeah, that's been an exciting couple weeks for me. I'm still very sore. Still very swollen. I was already swollen before this surgery. So I'm still very swollen now. They didn't have to open me up, thank God, because he was like, I really don't want to have to open you up because you just had a big surgery a couple months ago. But if I have to, I will. And I'm like, I'm fine with that. You know, do what you got to do. You know, it is what it is. But he didn't. He did the procedure laparoscopically. I have 5 small incisions. He was asking me about my belly button, and he was saying, I really don't want to touch that belly button because it's brand new. And I said, it was really not brand new. They just kind of repositioned it. And he's like, I don't want to touch it. So I have an incision above my belly button and 4 other incisions. You actually can see one of them right there, but 4 other laparoscopic incisions where they went in to, you know, with the cameras and to remove the gallbladder. One thing I can say is he was very impressed. After the surgery, he says, who did your surgery? And I'm thinking, oh my goodness, is something wrong? Is something, you know? And I told him, I said, Dr. Villari out of St. Pete. I couldn't remember his first name at the time because I was still kind of doped up. But Dr. Frederick Villari out of St. Pete did my tummy tuck. He says, he did an awesome job on you. He was like, you're probably gonna have abs at 80. He says, when we try to blow your stomach up from where he did the muscle repair, we could barely get air in there. Your stomach is so tight. And he says, that's a compliment. He did an awesome job on you. And he's like, he did really good. So that's a good thing. Once all this swelling goes down, at least, you know I got a good tummy tuck. But yeah, so that's pretty much it. Just wanted to share my journey the last couple weeks. I'm still recovering. They say that, you know, I can live a healthy life without, you know, restrictions. Of course, I do plan on changing my diet. Well, I already started trying to eat a little bit more healthier, but as far as like fatty foods, greasy, oily foods, I kind of try to stay away from those because I don't have a gallbladder which is, I still have some, like your liver takes over the work, they say. So your liver starts, you know, filtering out and helping do stuff. And then, of course, your digestive system. So that's the only thing. But, yeah, I just want to share my journey with you. I am going to sign off for now. Don't forget to like, comment, share, and subscribe. Bye.